Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our Hospital System General Director. Today is Thursday, June 10th, giving you the update from Albany Med. All right, Fred, we'll pop open the first graph here. Yep. Capital Region, people currently in the hospital with COVID, 35, so moving in the right direction.
That's
still.
Right. Small number.
And then the next graph here is inside Albany Medical Center, our morning census. Fred, we currently have 14. 5 of them are in the ICU. Right. One's on a ventilator. Here's an interesting number inside the number. In the last 7 days, we've had 8 come in and 7 go out. So we've sort of picked up 1. Of those 8 who came in, how many were fully vaccinated? 0.
0.
Yeah, 0. So if you're coming into the hospital with COVID, overwhelmingly, you're unvaccinated. So I think, obviously, that's a message we keep talking about.
Dennis, the vaccine works.
Yeah. All right, very good. Fred, speaking of COVID, what is the Delta variant and why should we be paying attention to that?
So first, Dennis, let's talk about the naming convention for the...
Yeah, Delta.
That's right, Delta. So we've begun to name the variants based on the Greek alphabet. So the original variant, the UK variant, is now being referred to as the Alpha variant.
Okay.
So we're now up to the 4th variant, which is the Delta variant, which came out of India.
Okay.
So there's a lot of conversation going on now about the Delta variant because it's even more transmissible than the Alpha variant. So to remind everyone, the Alpha variant was about 50% more transmissible than the original. Well, it turns out the Delta variant is about 50% more transmissible than the Alpha. And
we're certainly seeing in the news the challenges they're having in India with this
Absolutely.
variant.
And you know, and again, it speaks to the need for vaccination because there was so much transmission, so much infection in India that allowed this variant to develop. So in the UK, in March, there were 0 Delta variants. This month, it's 75%.
Okay.
So very rapidly has taken over.
So to be sure we know what we're talking about, the variant in the UK, we're not talking about the UK variant, you're talking about the Delta variant.
I'm sorry, yes. Yeah. So the Delta variant in the UK, it actually has become the dominant variant in 3 months.
Yeah, well, you said it right. I just wanted to make sure that we clarified that. And so what's the message for us?
Get vaccinated.
Okay.
Get vaccinated. It's very important. And I would also point out one more thing. It does appear that the vaccines are effective against the Delta variant. There's some data on both the AstraZeneca, which isn't in the United States, but also the Pfizer vaccine.
Okay.
And it does seem to work. So get vaccinated. Really important.
And people periodically will stop me and say, are we seeing of the people who are getting admitted to the hospital, Albany Med, examples of variants here? And the answer is they are samples that are sent to the Wadsworth lab.
That's right. So in April, we had 3 Delta variants. We haven't had any since.
Okay.
And there is a smattering down in the New York City area.
Okay.
So it hasn't really taken hold in New York State yet.
Right.
Nationally, it's about 6% of identified variants.
All right. Thank you, Fred. All right, let's shift gears. Let's talk about an incredibly important topic, which is retain, recruit, retain. We've been talking about this a lot. Fred, my understanding, of course I know this to be true, is lately we've had a series of hiring fairs.
We have, Dennis, and they've been really successful. We've had a hiring fair for the ED, for peri-op, for women and children, and most recently, I think it was yesterday, critical care.
Yep.
And actually we started with a hiring fair for the practice for some of their front end staff, the others having been for nursing. So it's, you know, it's a very important endeavor, you know, really try to get people into the organization.
Yeah, and it's been very successful. We thank HR for their efforts, certainly nursing for their efforts to make these happen. In each and every case, we've been able to successfully recruit some highly talented and skilled nurses. So we're welcoming them to the medical center, and we're going to have future ones as well. So medical and post-surgical, and I think we're going to take another run again at the practice. So maybe we'll continue to do these on a regular basis.
We've been encouraging HR and nursing and the practice to continue to do these through the summer and into the fall.
I think the next one, the medical post-surgical, is June 15th. So
That's
look
right,
for that on the internet. So Fred, it's retain, it's recruit, and it's retain. So let's start with retain. You know, one of our greatest assets, of course, is our workforce. And there was a wonderful profile on the intranet recently with one of our nurses who's been here for over 30 years. And that's somebody who you and I both worked with. I'm going to say she's actually one of my absolute favorite people at the medical center, such a fabulous nurse and a great leader.
She really is. Jen Miller.
Jen Miller.
Jen Miller. She's the nurse manager for C4 and C3 West. She is just a terrific person. Fantastic to work with.
Yep. Great profile.
Great profile. She's been here
31 years.
31 years.
31 years. Her entire professional career here at Albany Medical Center.
Yes.
So she's a lifer, and we're glad about that.
Absolutely. And she really has developed an expertise
Absolutely.
in managing patients with infectious diseases. C4 is our AIDS HIV unit, and a lot of more serious infectious diseases go to that unit. And Jen is truly an expert.
And the people who work on that unit obviously are very proficient in these types of things, how to wear the protective equipment,
right.
how to treat patients with infectious diseases. Dr. Blinkhorn, who we all remember, used to talk about C4. He used to call it a very special unit. That's what he called it.
Yeah.
And he was an infectious disease doctor, and
That's
he's right.
That's
so
right.
Very good.
Yes.
So congratulations to Jen. Great profile. Hopefully soon, we'll start featuring what we're going to call Inside Albany Med. I think we've talked about this a couple times. We're going to take members of our workforce, spend some time with them, get a chance to talk to them on camera, perhaps even in the locations where they work, really to give other members of the workforce a chance to learn a little bit more about the people who make this place run.
That's right, Dennis. You know, and you're wearing scrubs.
I am wearing scrubs today.
So you were in the OR today.
Yep.
And so you actually had that kind of interaction with some of the folks down in the OR.
Right. And you and I both do this, of
Yes.
course. A lot of leadership walks around. Today I was in the OR, so I put the scrubs on. The place is huge, right?
Yeah.
And we run 24 hours a day, so it's hard to be everywhere all the time. And sometimes you'll walk through places and people will be like, hey, I haven't seen you in a while.
Yeah.
But it was great to get through the OR again today and had an opportunity to see our entire surgical team, surgeons, anesthesiologists, surgical techs, nurses, obviously, all doing the great work that they do down there.
They really do a tremendous job. I was down there yesterday. Lisa has been there recently as well. It's good for a number of reasons, not the least of which I always learn something when I talk to our staff in the various different units.
You're so proud to work here because we know the mission we do, and we're both physicians, so I understand what happens in the emergency department. You obviously understand what happens in cardiology. And then you go into an environment where it's not something that you have done your whole career, and you just go, this place is incredible.
Right. You say, wow.
You do say, wow.
Yeah.
Starting next week, we're going to have our town halls. This obviously is something we really weren't able to do. Normally, we do them in January.
Right.
COVID. But we're going to start having them again. So let me look at my card. We're going to have one next Monday and Wednesday here at Albany Medical Center in ME 700. Then Friday, I'll be down at 1275 Broadway. And then the following week, back again on Wednesday in ME 700. Obviously, we're encouraging if you can attend in person, please do. If you can't, we're going to film one, so our entire workforce does it. This is really a look at what we're doing, a look at our strategic plan, what we have planned in the future. So it's a look back, it's a look forward. It should be a comprehensive review of things, and we encourage our workforce to come or to view it when it's available online.
Absolutely. And if you come, there's always an opportunity to ask questions.
And we certainly encourage questions, and we will take them as well.
Yes.
All right, I think that's it. Anything else going on today?
I think that's a lot, Dennis.
It is a lot going on. It's going to be a beautiful weekend, we hope. We always say on Thursday to those working here, 24/7, and the weekends, we thank you.
Yes.
And we'll be back again next week. All right. We ask that you once again, please take care of yourself, take care of each other, and we'll see you next Tuesday.